Welcome back. According to a report from Mental Health America, over 67% of Texas teens who suffered from depression last year did not receive any mental health services. That's one of the highest rates in the country, and it's something that Family Care Center in San Antonio is hoping to change, and they're doing so with some cutting-edge new treatments. Joining us now is the Regional Director, Jessica Miller. She is also a licensed clinical social worker. Good afternoon, and thanks for joining us, Jessica. Talk to us about the prevalence of mental health struggles for teens in our community.
Absolutely. Thank you for having me. NAMI San Antonio data shows that 4 million children and adolescents in this country suffer from a mental health condition. That turns into 1 in 6 school-aged children that would benefit from mental health care were it available. And the most important thing there is access. Access to care, access to clinics in your community, access through your insurance, and access to excellent mental health providers.
Now, what are some of the warning signs that parents can watch out for? When do you know it's time to seek for help?
That's a great question. Changes in behavior are really the first sign. This can often include withdrawal from friends and family, irritability, increased mood swings, frequent headaches or stomach aches that aren't explained by a medical cause, or changes in sleep or eating habits. If something doesn't feel right, we tell parents to trust your instincts. You know your children best. Reach out, even if you're just curious or unsure. A conversation can always lead to clarity and next steps.
Now, Jessica, there's a new treatment that was approved for teenagers only a few months ago called TMS. What is that, and what are the results so far?
TMS is extremely exciting. It is an FDA-approved, non-invasive treatment for serious depression when medication and therapy alone have not worked well. It uses gentle magnetic pulses to stimulate the areas of the brain that are responsible for mood regulation. It's a 30-session treatment over the course of 6 weeks. The treatment takes 20 minutes and there's no downtime. You're able to drive yourself to and from appointments. And in 2024, the FDA did approve it for teens, and Family Care Center has implemented it across our clinics. So now 17-year-olds don't need to wait for their birthday to access care.
So, Jessica, is that, do you think that's approved by the insurance, or is that something that parents need to look into for their teens?
Great question. It is approved by most major insurances, and Family Care Center is in network with most major insurances as well. And at Family Care Center, we are seeing 90% improvement in depressive symptoms for the patients that we treat through TMS. We've been doing TMS at our clinic since 2016, and in that time, we have done 80,000 TMS treatments.
So with the TMS, it looks like they're just putting that on their head and they just sit there, or is there talking that's going on?
Absolutely. It is a magnetic coil that rests on the head, and you are in the room with a TMS technician, so there can be conversation that's happening at the same time. Some patients choose to relax quietly, and some choose to engage with their TMS technician.
All right. Well, we appreciate your time. Thank you so much for joining us. We'll have a lot more information on our website, news4sa.com.